And the first thing that confuses everybody is a modifier, because 99% of the time you don't need to use a modifier. Right? You provide MNT, you see the patient in your office. There's nothing to use to modify it. Maybe you want to use a preventative code 33. You don't need that. They just recognize the CPT code. But a modifier can communicate where the site origination is, and that's important, right? Because the site origination means where you're located when you, the provider, give the service. So GT was developed to be telehealth, and then the important thing here is it's interactive audio and video, right? It's not just a phone call, but this is face-to-face. We can see each other. You can see your patient. So that's where they're making a delineation. We'll see GQ, which is asynchronous, which, that just makes things more confusing. It's pretty much a recording. You're recording some language or some education or whatever you're doing. This is especially for people like in Alaska and places where there's a big time difference, but you have to get them the information, but you can't coordinate and sync to be in person at the same time. But CMS confused everybody by saying use GQ, not GT, but it actually is incorrect. So there you go, more confusion. So any other question?
Of course.
Okay, so a couple of years ago, modifier 95 was created, and it's similar to GT. In other words, they're both going to say that you're providing MNT. And one thing I do know about 95 is that it is approved for MNT. It's approved for 97802, 3, and 4. All right, so in other words, you're putting the CPT code in for that date of service. You're choosing your location code, which will probably be 02 instead of 11. And then if you want, you could put in modifier 95 as well. And again, I'll show you what that all looks like. But that would be what seems to be a normal telehealth visit. All right, the procedure that you provided was MNT. The location, which would be telehealth, and then the modifier, which would probably be 95. You could use GT in almost any case and be approved. It's just that we know modifier 95 is absolutely approved for MNT. So I might suggest to use that. Okay, real quick on originating sites. Remember I said that the modifier basically tells the insurance company what the originating site is. First of all, these are a list, but the first one right on top is the office of the practitioner is an approved originating site for telehealth. So that's where it applies to all of us. So, Lara and Christine, you're in your office right now. If you provided a visit, great, it's approved. If you're providing the service from home, if technically speaking, if you didn't credential your home address as one of your locations, you might not be being compliant. Again, they're not checking that closely, but at least make sure you have your protections in place with HIPAA and all that. But a lot of us, when we originally credentialed with insurance companies, we put our home address until we had an office, and that remained a billing address. And when it's a billing address, sometimes it's also a location, a service facility location. So if that's the case, you're definitely okay to provide the service from home as far as the insurance company is concerned. But again, they're probably not auditing you. I don't think that any of these apply to any of us at the moment. If you're going to a patient's home, be careful, of course, that there's a risk for spreading the disease. But it really is meant for certain cases, especially with ESRD patients. Who are the approved practitioners? This is the list, and obviously, right, registered dietitians are on there, so that's a good thing. So again, as long as you're doing everything else right, telehealth should be approved according to CMS for us to provide that service. So far, so good. A little less confusing.